Okay, so I'm going to hand over. If you start with yourself, you can just introduce yourself, explain your workshop, and then do your bit, and then if we go down the line, so name, introduce yourself, your workshop, and then closing comments, and we'll just go down the line that way. If I've got to introduce yourself, it'll take longer than actually doing it. Is that okay? Super. Yes, you can join, Jackie. Yeah. If you can fit on. We'll probably need a wide screen now because there's so many of us. So as we come to the end of the summit, what a summit it's been. I must be honest, just as so Lee Rickles, the Programme Director for Yorkshire Number Care Record, but what a summit. I must be honest, I did come down on a Sunday afternoon. Those of you that follow Twitter might have picked that up when I did some snaps. And I was really thinking how many people are actually going to make the effort to come and attend the first National Shared Care Record Summit. I know we had Eventbrite, and I know we had quite a few people clicking on the link, and we had a lot of enthusiasm for the workshop, but there's always that little bit of who is really going to turn up. So I must be honest, I never sleep very well in a hotel, and at 4 o'clock in the morning when I went up and then went to the gym, that shouldn't be a surprise to most people that know me, after a little bit of stress, I was really, really glad with the amount of people that made the effort to come together to look at how we can improve shared care records, which really, if you fundamentally look at it, is all around how do we improve patient care, how do we prevent another instance like William so it doesn't happen again. So, I'm really proud of everybody who's turned up yesterday and today, how we will have come together, how we've shared knowledge, and how these workshop facilitators that are on the panel have also put effort and work in to pull the whole session together. So it's a real success, in my opinion, if you want to class success. But there are a few thank yous as well. Unfortunately, Louise Sinclair can't be here, but there is a big thank you for Louise. She has organised, cajoled, hassled, met, suggested and worked with everybody to make this event work. I might be a bit of a front guy, I might do a song and dance act, but Louise is the one that's actually made the difference. She's the one that's got the information out, she's the one that's communicated, a big thank you to Lou. And also a real big thank you to the committee. It was done by committee, it wasn't a dictatorship, although the committee might have a different view on sometimes, on some occasions. But yeah, it was done collaboratively. It was done by everybody in the room of what do we need to cover. We took the views from all our ICSs, they put comments in, and then we tried to fit that agenda around what was required, which should be what we're doing. It should be filling that need and then sharing knowledge and experience. And these speakers and panellists are the people that actually put the hard work into putting them materials together and then working through them workshops. And we'll hear from them in a moment of what's been the important take-home and their closing comments. I'd also like to say thank you to the suppliers. One, because they've helped subsidise the cost of the event, which is always really, really helpful. But also the suppliers are absolutely essential to everything we're doing. We cannot join information together without the suppliers providing the systems that join that information and actually provide it in a safe and secure way. The reality is we've got to work in partnership with suppliers. We've got to work in partnership with arm's length bodies like PRSB, who've had a lot of input into what we've been doing, and also HL7 and even Tech UK. I think there's probably a brokership deal with Tech UK with our suppliers and ourselves of how we can work more collegially together. Because let's be honest, when we look at the number of shared care record suppliers out there, there isn't that many. There's less of them than there is of ICSs, so we really need to look at how we can use some of them other organisations to make the whole journey easier for us all. So at that point, I'm going to hand over to Sophie, and what we're going to do is do a bit of a go down the line, and each of the speakers is going to feedback on their session, any actions and next steps. So over to you, Sophie.
Okay. Hi everybody, I'm Sophie Losley and I work for Interweave. On the first day I held the Data Standards Workshop I was really, really happy to see so many people there because I think data standards is sometimes seen as a bit of a dry subject. But everybody was really enthusiastic. And there were certainly some common themes that came out around issues that were surrounding data standards in the shared care record. And what we've managed to do is actually set up a few working groups to work on those. So the main issues that came out was around education. So educating people on what data standards actually are and what they enable. There was also a common theme around mandating data standards, which I know John covered this morning for me, which was really helpful. But there's a lot of work that we can be doing whilst that mandation is going through as well. There was also another common theme about making sure it covers health and social care, so we don't leave out those social care partners. And there was also another one where it was about making them easier to understand. So easier to understand and easier to use. But yes, I'd like to thank everybody once again for participating in that workshop, and I think we've got some really good working groups going forward. And if anybody else would like to participate in those, please come and see me and we will also get you involved. Thank you.
Hi, I'm Ian Lawrence. I'm a GP and a CCIO for Derbyshire Community Health Services. I've just finished running a workshop which was around the clinical perspective and the CCIO perspective. What have I taken away? It was I thought a very engaging session, and I was really heartened by how much people were willing and wanted to contribute, and I think that's a reflection on how keen people are that the shared care records that we're producing are useful and usable and used by the clinical workforce that we're creating them for, to help them look after patients as best they can. So a message that I took taken away from that and the whole summit is that there's a real journey that we're on, and it feels like we're taking the first steps on a journey where there aren't many shortcuts, and we'll be working one thing out after another, and we'll be doing it for quite some time. We're talking about just getting information shared and together, and yet we're also having conversations about using AI algorithms to flag things to clinicians that they might not have thought of. So we've got a long way to go, but it's going to be quite an exciting and positive journey as we go. And then just from my workshop, the importance of not just sharing and collecting the data, but curating it so that people can look at it and take meaningful information from it and use it to make much better decisions. There's a real challenge in that. That it's from the enthusiasm in the workshop that I've just read. I think people are up for that challenge and keen to resolve it. There's a bit in there around quite a lot of that could be resolved would be better resolved at a much bigger level around getting people to agree standards. So we talked about data standards, but we were talking about standards for presentation to clinicians, making sure everybody knows what that symbol means and where to look for what piece of information, because at the moment every clinical system is different.
Thank you. Hi there, I'm Rebecca Wilson. I'm the Clinical Safety Lead for the Auction Humber Shared Care Record. I'm a senior pharmacy technician by background and senior clinical safety officer. So I ran the clinical safety workshop today with my colleague here, Dean, and another CSO, Vicky Finn from Leeds, who can't be here at the moment, and Orla, the CTO from Yaz. The workshop went really well. Again, like Sophie said, around data standards, it can be a dry subject, but we had the participation from the crowd eventually, and they was all getting up and posting the post-it notes onto the relevant sheets, which was good to help us identify, further hazards and challenges as well, I think, in the clinical safety arena, which was good. There was common themes that was coming through regarding, obviously, the data quality and the concern around missing data and terminology differences within the shared care record. But, you know, that's not new to us. It is a common theme that we already know about. And also thinking around what does it look like in the future? So what does that framework look like and the governance when the shared care records connect together? So I think we've taken away from that, you know, the clinical safety officers working groups and wider as well. So looking at the social care, definitely aspect of things. There seems to be the gap still in social care and in the ICBs and ICSs around clinical safety officers and who's responsible for what and when. And one of our key messages was really trying to embed the process with the people and not it just being a tick box exercise. Really good workshop, really enjoyed it, but we could have spoken all day and all week around clinical safety and what it involves. So yeah, thank you for everybody that was involved in that and hope to see you again.
Hi, my name's Dean Mawson. I'm an independent clinical safety officer and presented at the clinical safety workshop as well. So the actions that we took away, as Rebecca was talking around, sort of from a governance framework perspective. So there's a keen interest for looking at the regional networks for clinical safety officers. So we'll be, as a fellow for the Faculty of Clinical Informatics, we'll be looking at that in line with the conjunction with the Clinical Safety Special Interest Group, and also some questions around the retrospective digital health systems and how we assure those systems. So there are some resources that we will be sharing around retrospective safety assurance and also looking at scope definition as well when we start that process around structured intended use and looking at that information as well.
Hi, I'm Tracy O'Brien. I co-hosted the session on information sharing, putting the system at the heart of what we do. We were really mindful that this was a call for action these last 2 days and making sure that we had clear outcomes and we weren't just talking. So it was fantastic for all of us to reconnect, and the actions that we specifically identified was that we would do some show and tells about how some people have done this work before. So, for example, people are sharing with care homes. Let's just have a 15-minute session with people saying, we're sharing with care home, this is what we did, this is the legal basis, because it was an IG workshop, and then we can all crack on when we're ready and when the ICS prioritises it within your shared care record. We talked about medical examiners, for example. So many of us are already sharing data with medical examiners. Let's get that knowledge out there about how we did it, why we did it, what was the legal basis for doing that sharing. Some people also said that they needed support with some of the more routine IG. So I don't see IG as a barrier. I know some of the colleagues that did the workshop do, and think that's a good thing. I see IG as a task, but there were some demands from the workshop about what support we need from the national team on IG, because we're all duplicating work. We haven't got the resources, and I think one of the common themes is how do we make this sustainable for all of us? And we're only going to do that if we all together use our talent and create those creative networks so that we can reuse the collateral that many of us have already created. I think that was it. Thank you.
Thanks, Tracy. I'm Jackie Bell. I'm the Benefits Lead at NHS England for Shared Care Records. And along with my colleague Gareth Kurt, Jay Richardson and Dr. Paula Bennett, we did the session yesterday on benefits. We asked the group to identify a key action, just one each, that they would take back to their workplace. And I was really pleased to see that the key actions that 59 people logged were the things that we'd talked about in our session. So that was good. I'll just give you sort of a highlight of those. One person wrote, make benefits of the shared care record real, use cases to change hearts and minds of users. Another person said, check that benefits highlighted in your business case are realistic and achievable. Somebody else said that they should connect with their operational managers and their existing clinical forums. Don't reinvent the wheel. If you've got those things already there, use those. Make sure your directors in all partner organisations are engaged in benefits. That was one of our key challenges, that we thought that our stakeholder engagement for some of the local benefits leads was really difficult, and without that executive level buy-in, it was made more difficult. Somebody else said that they aim to implement the benefits management at the inception stage and continue to monitor. So that was one of our other key points, was that, don't just do it at the end. Don't do your benefits work when you've already gone live. Do it when you're thinking about a project, when you'll be able to identify your problems much more easily from which your benefits are derived. So ensure all stakeholders realise that benefits are important. And the key message I think we probably all got from this event was learning from each other, learning from other sites, use the NHS Future sites to learn more about our regional and national benefits, and feel free to touch base with myself or Gareth if you'd like any links to anything. And we do have a networking meeting on a monthly basis with the benefits lead, so if anybody isn't a member of that and would like to be, let us know. Thank you.
So hi, I'm Lisa Sill, Programme Director for Great North Care Record. I think mine and Joss's session's probably quite fresh. At the risk of repeating what others have said, I think my takeaway from here is we have talent, we have the expertise, we have the will. How do we connect that, and how do we make all of the shared care records get to the same level of maturity to bring the benefits that we need to bring? I thought the opening session was really powerful in terms of why we are here, what it is we're here to achieve. I feel overwhelmed by information, but at the same time I feel very energised. We can do this if we work together. We can go faster, we can go further, which I know can be a bit of a cliche. The other piece is, how do we truly engage the leadership in the ICBs around the importance of this? How do we get them to commit at a board level that this is one of the tools that's going to take us where we need to be in terms of improving health and care for our population? So, thank you.
Super, thank you all. And it's been great that you've all run the workshops as well. So just a few points from me before we close. So we did have a surprise visit from a guy called Tim Ferriss. You may have met him or seen him, if you could, earlier today. And I think Tim was actually quite surprised by how many people were actually here. And also that when he raised a few issues, it was quite good, because when he raised an issue about London data sharing, we brought Josh out and she then went through why and the what. And then when he raised an issue around IG, we went down to the IG session that was taking place. So it's quite poignant that all the people were here to solve some problems. Now, Tim then gave a couple of challenges back. I can't promise money around this. We'll just have to we'll just have to follow up with Tim on that. But I think the key bit, and I think after the Williams story, we can all appreciate it. We've all got shared care records. They're all at different levels of maturity, and they all have information. But we still struggle with pulling the important problems, the important information from them shared care records together to form a national view. So if you do actually, I don't know, live in Cornwall and decide to go up to Hull for your holidays, because that's a regular thing. To be fair, I couldn't believe Tim actually had been to Hull and he'd actually talked about it, but that's another story. Well, it's the little things that count really sometimes. So yeah, Tim put that challenge in to do it within a year. Now, we could either overthink this and really start sitting down with a load of techies and start looking at how we're going to spend billions of pounds to join stuff together, or we can look at how we use some national assets. So I would interpret the challenges as probably, let's be a bit more ambitious, or at least in the short term. because we have got the proof of concept work that's going to be the long-term piece, which is, can we get the National Record Locator linked to our shared care records in the next 12 months, so our 11 ambulance services don't have us to scrabble around for information? And there may be limitations with National Record Locator, there may be challenges, but we're talking about services that have access to nothing or very little, so something is better than nothing. At least that's easy for me as a non-clinician who doesn't do emergency care to say. But with the people in the room, we can make that happen. We will need some support, we will need some level of resources, but why wouldn't we? Or we can spend the next 3 years thinking about how we're going to join ambulance services together and data. It may not be a perfect solution, but we shouldn't let good be the enemy of perfection. I've got that all wrong way around. I wrote it down and everything. We shouldn't let perfection be the enemy of good. And I think that's a good example. So I believe Astrid has already been hassling a number of ICSs, and we've got some signed up. More than half. So what? Super. Well, more than half means we can at least get half on the journey. And let's be honest, we can't do all this at the same time, but at least if we can get some progress, iron out some of the issues, a lot of them vendor systems will be connecting to the same solution if you use the NRL. So we don't necessarily have to have 15 conversations of Orion and 15 conversations with GraphNet and 15 conversations with systems. There are other providers out there, by the way. We can have it with them once and then try and get how we're going to do this in practice. So I would like to put that as a challenge to ourselves. I suppose the question is, and I don't want to put anybody on the spot, but would anybody think that's a bad idea? I know nobody's going to say it. So rather than anybody feeding back, can I just have everybody standing up who supports that approach? Well, we'll take it as 42. So I think that's really important. And I think the key bit is we've now got to the point of actually trying to make it happen. So there will be some communications, and we do need to do some boring preparatory work and things, but people are already using it. It's already happening. So we're not starting from a clean sheet of paper. We are starting with experience and knowledge. So let's build on that experience and knowledge, as well as the examples that the panelists have already given, and that will set us up brilliantly to feedback how successful we've been at the second National Shared Care Records Summit, which we do need one of the shared care records to offer to host it. If none of you offer, I'll drag you all back to Leeds again, or even worse, I'll drag you all to Hull. It's Hull, not hell. Very nice place, actually. You should come and see the museums in the deep, and I'm hoping they're going to get that £5 in the post from the council for that one. But yes, with all seriousness, we do need to look at where we're going to be in a year's time and have somebody else willing to run the summit. It would be brilliant to go to another part of the country and for another region to lead. So at that point, I'm going to say thank you very much, everybody. It's been an absolute pleasure seeing you all. And I definitely expect to see you at some location in England in about a year's time. So safe journeys, everybody. Thank you very much. Thank you, everybody.